Before we do anything else today, let's do a very simple belly fat self-check. In the next 30 seconds, you're going to get a quick snapshot of whether your waistline may be telling you more about your health than you realize right now. No complicated medical terms, no guessing, just honest answers. If you are over 60 and you've been noticing a thicker waist, a tighter belt, lower energy, poorer sleep, or a body that just does not feel as strong and responsive as it used to, this matters more than many men realize. Because belly fat rarely walks into your life wearing a name tag. It usually shows up as a slow drift, a little less muscle, a little worse sleep, a little more blood pressure, a little more blood sugar, a little less stamina, and men often call all of it just getting older. I'm Dr. James Whitaker, and here's how this works. You are starting with a perfect score of 7 points. I'm going to describe 7 common belly fat warning patterns. For each one that applies to you, subtract 1 point. At the end, you'll have a clearer sense of whether your body may be showing a broader pattern worth paying attention to. And stay with me until the end, because the #1 mistake men make with belly fat is the one that keeps them focused on appearance while missing the much bigger health message underneath it. Let's begin. You start with 7 points. Number 1. Has your waistline clearly increased over the last few years, even if your total body weight has not changed as dramatically as you expected? If yes, subtract 1 point. Number 2. Do you have higher blood pressure, higher blood sugar, prediabetes, diabetes, or worsening cholesterol, and tend to think of those as separate from your belly fat? If yes, subtract 1 point. Number 3. Have you become less active, lost muscle, or noticed that your body feels softer and less physically capable than it used to? If yes, subtract 1 point. Number 4. Do you sleep poorly, snore heavily, or wake up feeling tired even after what should have been a full night of sleep? If yes, subtract 1 point. Number 5. Do you feel like your energy, stamina, or recovery have quietly declined over time? If yes, subtract 1 point. Number 6. Have you been telling yourself that because you still function day to day, the extra weight around the middle probably is not a big deal? If yes, subtract 1 point. Number 7. Do you think of belly fat mostly as a cosmetic problem instead of asking whether it may be part of a deeper health pattern? If yes, subtract your final point. Now look at your number. If you scored 6 or 7, that is a stronger starting point. You may not be showing many obvious belly fat warning patterns right now, and that is good news. If you scored 4 to 5, your body may be sending early signals. That does not automatically mean something severe is happening, but it does mean the pattern deserves attention. If you scored 3 or lower, please don't panic and don't feel embarrassed. Many older men live with these changes for years without ever realizing that fat around the waist is often more than simple weight gain. The goal today is not fear, it is awareness. Go ahead and write your score in the comments. I'd also like to know your age, where you're watching from, and which issue bothers you most right now. Is it the larger waistline, lower energy, high blood pressure, rising blood sugar, poor sleep? Save your score, because we're coming back to it. Now let me give you 1 minute of simple science. Not all body fat behaves the same way. The fat that gathers deeper in the abdomen around the organs is often called visceral fat. And that is what makes belly fat such an important conversation after 60. It is not just extra padding under the skin. In many men, it reflects a more active, more inflammatory, and more metabolically disruptive kind of fat pattern. That is why this matters. Mayo Clinic, Cleveland Clinic, and NIDDK all make it clear that carrying extra fat around the waist is linked with higher risk for high blood pressure, type 2 diabetes, heart disease, metabolic syndrome, sleep problems, and other long-term health issues. Mayo Clinic also notes that for men, a waist measurement above 40 inches signals an unhealthy amount of belly fat and a higher risk of health problems. Here is what makes this tricky after 60. Men often do not feel sick from belly fat in the beginning. That is exactly why it gets ignored. A man may still go to work, run errands, mow the lawn, and live normal life while his blood pressure rises, his blood sugar drifts upward, his sleep worsens, and his energy slowly drops. So because nothing feels dramatic, he tells himself he is fine. That is why the pattern matters. Belly fat is not usually just one visible change. It is usually a cluster, several systems moving in the wrong direction at the same time. So now let's count down the 3 biggest messages your body may be sending when belly fat is part of a deeper health story. We're going from number 3 to number 1, and number 1 is the one most men dismiss the longest. Number 3 is this. Your body may be telling you that belly fat is not just about weight, it is about where the weight is being stored. This is one of the earliest patterns men miss. Even if they do not use those words, they say, "I've gained a little weight, but who hasn't?" Or they say, "It's just a thicker middle." That happens with age. And because the change happened gradually, they shrug it off. Here is how to notice this more clearly. Ask yourself whether the change is especially happening around the waist. Is the belt tighter? Are your pants fitting differently? Is your body shape changing even if the scale is not shocking you? That pattern matters because fat around the abdomen is often more dangerous than men assume. What should you notice? Belly fat often shows up as a growing waistline that feels out of proportion to the rest of the body. And in many men, that waistline change is happening at the same time energy, blood pressure, sleep, and metabolic health are also drifting the wrong way. Why does this matter? Because many men focus only on total body weight and miss the fact that where the fat is stored can tell a much more important health story. The most common mistake is saying, "I'm not that heavy, so this probably isn't serious." If you need an easier version of this check, ask yourself one question this week. Is my waistline growing in a way that may be telling me more than the scale is? That question can reveal a lot. Number 2 is this. Your body may be telling you that belly fat usually travels with a broader metabolic pattern. A lot of men focus only on the mirror. That is understandable. But when belly fat is part of a deeper health issue, it often does not come alone. It may come with higher blood pressure, worse blood sugar, lower HDL cholesterol, poorer sleep, less stamina, and a body that feels less efficient overall. Here is how to think about it more clearly. The body is rarely separating those things as neatly as men do in their minds. What should you notice? Belly fat tied to metabolic decline often feels less like one isolated body shape issue, and more like your whole system has lost some of its edge. Why does this matter? Because if a man looks only at his appearance and ignores blood pressure, blood sugar, sleep, stamina, and recovery, he may miss the bigger message his body is sending. The most common mistake is trying to solve belly fat like a cosmetic issue while ignoring the deeper health pattern underneath it. If you need an easier version, ask yourself this. Is this only about how I look, or does it feel like my whole body has become heavier, slower, and less resilient? That distinction matters. And before we move to number 1, if this video is helping you understand your body more clearly, take a moment to like the video and subscribe to American Urologist. It helps me reach more older men who may be quietly living with these changes but have never had them explained in practical, respectful language. And if you've made it this far, let me know in the comments which belly fat warning sign you think men ignore for the longest. Now let's get to number 1. Number 1 is this. Your body may be telling you that the biggest mistake is assuming belly fat is harmless because you still feel mostly fine. This is the message men miss the most. A lot of men assume that if they are not in pain, not in the hospital, and still functioning, then the extra fat around the middle is mostly cosmetic. But belly fat often works quietly. It changes the internal environment of the body over time. It can move with rising blood pressure, worsening blood sugar, heart risk, lower testosterone patterns, poorer sleep, and reduced physical function. And because these changes build slowly, men adapt instead of responding. Here is what I want you to watch for. Are you heavier through the waist than you used to be? Less active? More easily tired? More likely to snore? If several of those are moving together, your body is asking for a closer look. What should you notice if you stop minimizing this? Clarity. Because once you see belly fat as part of a broader health pattern, you stop treating it like a simple appearance issue. Why does this help? Because the bigger picture is what makes the pattern meaningful. One tighter waistband can be easy to ignore, but a tighter waistband linked with fatigue, worse sleep, rising pressure, and weaker metabolic health tells a much stronger story. The most common mistake is waiting until a diagnosis arrives before admitting the earlier pattern mattered. If you need an easier version, remember this. Dangerous belly fat is often not one symptom shouted loudly. It is several systems quietly drifting downward together. Now let me give you 3 daily boosters that can help older men think more intelligently about belly fat. First, pay attention to your waistline honestly, not just your weight. Waist size can reveal risk long before men think of themselves as unhealthy. Second, notice sleep, blood pressure, and blood sugar alongside your waistline. Those patterns often travel together. Better metabolic habits are often better waistline habits too. Third, stop treating belly fat like it is only about looks. Think in clusters. Waist size, stamina, sleep, blood pressure, blood sugar, strength, and energy together often tell you more than any one sign on its own. Now let's close the loop. Think back to your starting score. If you scored low today, don't let that disappear into the background. Recheck yourself in 2 weeks. Not because the pattern will magically change overnight, but because awareness changes how honestly you observe your own body. Track whether the pattern feels stable, improving, or quietly worsening. Today, we talked about why belly fat is so dangerous for men over 60, even when they feel fine. We looked at how belly fat can reflect visceral fat and deeper metabolic risk, how it often travels with blood pressure, blood sugar, sleep, and lower stamina, and why the biggest mistake is treating it like a harmless cosmetic change. If this video helped you, share it with another man over 60 who says he feels fine but is clearly carrying more around the middle than he used to. And if you want to keep going, watch the next video on your screen where I'll break down whether Ozempic and Wegovy are safe for men over 65 and the muscle loss truth older men need to hear. I'm Dr. James Whitaker. Stay informed, stay steady, and I'll see you in the next one.